Hello, I am Anumeha Sheth. I'm a neurologist with Hartford Healthcare Eye and Neuroscience Institute. I am an epilepsy specialist, and I'm also the program director of the Epilepsy Fellowship. I like every aspect of epilepsy, but within epilepsy, I am very passionate about care of women and issues specific to women with epilepsy. Some of those are epilepsy in pregnancy, hormonal seizures, epilepsy after pregnancy, such as postpartum, outcomes of children born to women with epilepsy, etc. There are a lot of changes throughout pregnancy which require close monitoring and maybe possibly even changing medications while you're pregnant. Seizure medications can also affect the outcome of the baby, including the neurodevelopmental outcome. So this is something that needs to be planned and discussed in advance and closely monitored throughout pregnancy. Yeah, there are treatments that are alternative to just purely using medicine, especially to patients who do not respond to medications and keep on having seizures, and that really impacts their quality of life in a negative way. We can offer surgical treatments, and those treatments might be in removing a part of your brain that's producing seizures, or inserting a device in your brain that will eventually modulate the activity of your brain waves and produce a over time will reduce seizures. My philosophy of care is centered around empowering patients to take ownership of their own health. I like listening to patients and addressing where their primary concern is, and I want to understand what their concerns are and how I can help them best. Patients should know that I am not only interested in just treating their epilepsy, but treating them to the best of my ability. For example, it could be psychiatric care, it could be social work, case management, counseling, all kinds of things that are very, very important. Outside of medicine, I like to cook, I like to bake, I like to entertain friends, and I like to travel and explore Connecticut with my young family.